One of the questions that we get most often when it comes to energy as a service is, how is the operations and maintenance of the energy assets treated long term? And the answer is, it depends. It depends on the customer and their key objectives, as well as their current risk appetite. At a very minimum, the answer is that no existing staffing are displaced or interrupted as part of this program. It's completely up to the customer how they structure through several different options, how Bernhard might interact with your existing operations and maintenance staff, add on to your existing staff and their tools and their resources, as well as take on additional responsibility and risk off of that staff's plate. One option for operations and maintenance is simply subcontracting back to your existing competent staff. In those instances, they get access to Bernhard's additional resources, tools, and training. A great example of that is CHRISTUS Health. CHRISTUS had already recognized the value of partnering with another competent third party to operate and maintain their facilities. So instead of interrupting that relationship, Bernhard was able to craft a subcontract where we keep the existing relationship with a third party contractor, CBRE in this case, intact and in whole, and really Bernhard is additional expertise is bolted on to that existing relationship for the benefit of both parties. It reduces CBRE's risk in their core business, which is operating and maintaining the facilities, as well as gives CHRISTUS the peace of mind of another third-party expert coming onto their team to operate and maintain their facilities and ensure the fact that they'll have thermal services delivered to their core businesses 24/7, 365 days a year. A great example of a labor services contract is our original energy as a service partner, Ochsner Health. We've had a labor services contract there where we lease a pool of their employees to help operate and maintain the central energy systems at their Jefferson campus for 8 years now. It's been a great relationship where our team is able to add additional expertise to their existing staff while still maintaining the fact that their staff are still Ochsner employees. They still have Ochsner on their shirt and still have Ochsner on their paychecks, and they're members of those communities and ultimately patients at those facilities, to where it's very important for them to maintain that existing status quo with their staffing levels. We're able to add additional training onto their staff, which include Bernhard Connect, which is real-time measurement verification, as well as automated fault detection, as well as additional training services on those tools, as well as the rest of their building automation system across their facilities to help them maintain the guaranteed level of savings generated based off their consumption across their facility. Another option of a full risk transfer is Midland Health in Midland County, Texas. Midland is in the middle of the Permian oil basin and is a boom and bust town depending on the price of oil. As such, they're not able to properly hire, train, and retain competent staff while competing with the oil boom and bust. So they partner with Bernhard through Energy as a Service, really with the key objective bringing Bernhard to the table to help bring a deep bench of operations and maintenance staff to where we could competently and confidently operate and maintain their equipment and free them of the risk of hiring, training, and retaining that key staff that they needed for their facilities. As you can see, Bernhard's Energy as a Service program is not a wholesale outsourcing of operations and maintenance. It's designed to be a long-term partnership between Bernhard and you, the customer, and it's customized in order to meet your specific needs for your facility, for your staff, and for your long-term risk appetite.